So, today we're going to dive into the science behind something you see all the time in newborns, jaundice. But we're going to do it by following the real-life case of a little baby named Nia, whose first day of life turned into a race against time, revealing a really complex biological drama. Let's get into it. Now, this might sound like the start of a strange riddle, right? But this question is actually the key to Nia's entire story. You've got the symptom, the cause, and the cure all right there. And by the time we're done, you'll see exactly how these three seemingly random things are perfectly connected.
So let's meet Nia. This is where the science gets very, very real. She's not even a day old, and she's showing these classic signs that are, well, they're pretty scary for new parents. The yellow skin is the obvious one, but it's the fact that she's so tired and not eating, that's what really tells the doctors that something serious is brewing under the surface.
Okay, so let's imagine we're in that hospital room with the family. The medical team can see the outward signs, but it's one single number from a quick blood test that's about to reveal just how big this emergency really is.
And here it is. The blood test comes back with this number, 274 micromoles per liter. Now to you and me, that might just be a number. But for a baby who is only 18 hours old, that number is screaming danger. It's critically high, and it tells the team they need to act and act fast.
This right here is the central question her team needs to answer, like right now. What on earth is going on in her tiny body to produce a number that high? And more importantly, what's the risk to Nia if they don't get this under control?
To really understand the danger Nia is in, we have to talk about the molecule at the very heart of this problem. This brings us to the core pathophysiology, which you can kind of think of as a bilirubin backlog. Basically, a massive traffic jam on a biological highway.
So what even is bilirubin? The easiest way to think about it is as a waste product. Your body is constantly breaking down old red blood cells to recycle them, and bilirubin is this orange-yellow stuff that gets left over. It's a totally normal process, but this stuff is toxic if it builds up, so the body has a system to get rid of it.
And in a healthy body, this system is a super smooth four-step assembly line. Old red blood cells break down, producing what's called unconjugated bilirubin. From there, it goes to the liver, which is like the main processing plant. The liver uses an enzyme to change it, or conjugate it, making it water-soluble. Once it's water-soluble, it's harmless and can be flushed right out of the body. Simple.
So what goes so wrong in a newborn like Nia? Well, it's basically a perfect storm of factors. First off, newborns have a super high turnover of red blood cells, so they're making way more bilirubin to begin with. At the same time, their liver is brand new and immature, so that key enzyme that does the processing just can't keep up with the workload. On top of that, their gut actually reabsorbs some of it back into the blood. And if the baby isn't feeding well, they get dehydrated, which slows the whole system down even more, creating this really dangerous vicious cycle.
Now this backlog, this traffic jam, it isn't just a cosmetic issue that turns the skin yellow. This poses a direct and very serious threat to a newborn's most vulnerable organ, the brain.
And here is the absolute key to understanding the danger. Not all bilirubin is created equal. On the left, you've got the problem child, the unconjugated form. It's lipid-soluble, which basically means it's fat-soluble, kind of like oil. And that property is exactly what makes it toxic to the brain. On the right, that's our goal, the conjugated form. It's water-soluble, non-toxic, and super easy for the body to get rid of.
And this slide really gets to the heart of it. Because it's oily and fat-soluble, that toxic bilirubin crosses the blood-brain barrier. A protective wall that, in a newborn, isn't even fully built yet. It can literally seep into critical parts of the brain, like the basal ganglia, and start poisoning the neurons. That's what we call neurotoxicity.
This is the absolute worst-case scenario. This is what everyone is fighting to prevent. If that neurotoxicity isn't stopped, it leads to a condition called Kernicterus. And the word to focus on here is irreversible. This is permanent brain injury. The stakes just could not be higher.
Okay, so you've got a chemical problem that's overwhelming the body's own systems. How in the world do you fight back? In this case, the answer is incredibly elegant and frankly beautiful. You use light.
The main treatment is called phototherapy. It's a non-invasive process where the baby is placed under these special blue lights. Now, it's not just any old light. It's a very specific wavelength of blue light that's perfectly tuned to interact with those bilirubin molecules that are hanging out in the baby's skin.
So how does a light mean fix a chemical traffic jam? It's pretty amazing, actually. The energy from the blue light goes right through the skin and gets absorbed by those toxic bilirubin molecules. That energy zap triggers a chemical reaction that literally changes the molecule's shape, twisting it into a new, harmless form called lumorubin. And here's the magic trick. Bilirubin is already water-soluble. It doesn't need the liver at all. It can be flushed out directly, completely bypassing that overworked, backlogged organ.
But as incredible as phototherapy is, you can't just stick a baby under a lamp and call it a day. The technology alone isn't enough. To really work, it needs a whole system of support care working right alongside it.
The light is doing its job, but the body needs a ton of help. Hydration is absolutely critical to help flush out all that converted bilirubin. You need someone constantly monitoring the baby's levels, their hydration, and looking for any changes. Nurses are working hard to make sure as much skin as possible is under the light, while also diligently protecting the baby's delicate eyes. And just as important, they're making sure parents still get to hold and bond with their baby during breaks from the treatment. All of this medical technology and supportive care is happening inside a deeply human story. And this brings us to a really vital part of this whole thing. Fixing the pathophysiology is only half the battle. True healing means caring for the family that's going through the crisis.
This one detail from Nia's case file, it just stops you in your tracks. Her parents aren't just worried new parents. They are carrying the trauma and anxiety from 2 previous losses. You can only imagine how that kind of intense fear makes it almost impossible to absorb complex medical information or make decisions.
So to meet these really complex needs, you have to take a holistic, family-centered approach. This model here shows how it works. You've got the physical part, Tiena, which is all about optimizing Nia's treatment. But just as crucial is Hinengoro, the mental well-being, which means validating her parents' anxiety, not dismissing it. And it means respecting their spiritual beliefs and actively including the entire family, or wanu, in the care plan.
And this all boils down to a really powerful point. True care isn't just about treating the illness. It requires equity. It means recognizing that Naya's family, with their specific history and their social context, has unique needs. It means giving them tailored support and clear, compassionate communication to make sure Naya gets the best possible outcome, not just in the hospital, but for the rest of her life.
Nia's story really shows us that pathophysiology happens inside a person, and that person exists at the center of a family's world. So it leaves us with this big question to think about. When we treat a patient, are we just fixing a body, or are we healing a family?